Welcome to our video that's going to discuss some of the specific information around privacy legislation and the health sector specifically. We're going to talk about PIPEDA and some of the provincial equivalents, and we're going to talk about some of the requirements on the health sector, which may be a little bit different than other folks, just more generally in commercial enterprise. So as we discussed before, PIPEDA is the Personal Information and Protection of Electronic Documents Act, and it's the federal legislation which protects personal information, and that includes health information. There are 10 principles that organizations, individuals, associations, they say partnerships and trade unions, folks need to follow when they're collecting, using, or disclosing the data in the course of their activities. And the Act does not apply to personal information or provinces and territories that have their own legislation in place. And it does not apply in the province of Quebec because it's got its own legislation as well. But we'll talk a little bit about those other ones in a moment. What's important to know is the provincial legislation is substantially similar to the federal legislation. So the core concepts are going to be the same, whether or not you're in a province that uses PIPEDA or your own specific legislation. The core concepts are the same. The key features include you must obtain consent and you must identify the purpose for the collection of the personal information. You must also get any kind of extra consent if you're going to use it for other purposes, and that includes any secondary or disclosure purposes. The Act requires that you communicate to the individual and you have to explain it and disclose it. So you can't just hand over a form and have everyone sign it. They actually have to have an opportunity to ask questions and receive answers. There are 10 key principles, and this applies not just to the health sector, but more generally. And then there's some specific pieces associated with the health sector itself. The first is that organizations are accountable for the protection of the information that's under their control. The purpose of the information must be identified during the collection of the information or before it. Can't be after it. The information has to be collected with the advance knowledge and consent of the person and must be given for a reasonable purpose. So you can't just come up with some crazy idea of how you're going to use the information. It has to be reasonable. It must be limited to what is necessary for the purposes. And the information has to be collected in a fair and lawful means. So you can't steal the information, you can't break into somebody else's, you can't use information somebody else has gathered without their knowledge. The information can only be used for the purposes it was collected and given consent for, and can only be kept as long as that's required for its purpose. Now, some organizations or professions will have requirements that it be kept for a certain period of time. 7 years is a common one, but it can't be kept indefinitely. There must be an end time for the keeping of the information. It has to be kept up to date, complete, and must be kept accurately. So there's a positive obligation to make sure. Now, if you're coming into a hospital, one of the key things that people do is check all of your information and your addresses. That's an example of keeping up the obligation to fulfill. It must be collected and kept with adequate safeguards. So there has to be a requirement that it be kept safe in some way. The information about an organization's privacy policies and practices has to be readily available. So it can be on a poster, it can be discussed with people, it can be on a form if the form is easily read, but people must be able to have an understanding about what the policies and procedures are. The information has to be accessible for review and correction. So the person can't just have it hidden away. The person whose information it is must be able to have some access to it if they need it. And the organizations need to provide the means to an individual to challenge the organization's compliance. So if it means that there is a poster or a number or an email or a telephone number or a process, there has to be an officer, somebody responsible that people who've had information collected about them can go to and complain or double check. So these are the 10 basic principles behind privacy legislation, and in this case, PIPEDA. So what's specific about health professionals? Well, really, PIPEDA has minimal impact on some of the regulated health professionals who are in commercial activities, who will probably also have their own privacy, confidentiality, and practices in place. You, as a regulated health professional, already have your requirements pursuant to your professional duties and obligations, so they're pretty much the same. And so there's usually the requirements of your own health profession that fit fairly seamlessly into PIPEDA. Where barriers are put in place by one kind of legislation, it's usually respected by the other. So health professionals always have to ensure the following things. 1, they have to let patients know about the collection, use, or disclosure of the information. So health professionals have a positive obligation. Again, they have to obtain consent to disclose the information to third parties if it's appropriate. So that's an example in the older adult context, that if you want to tell a family member or friend something about the interview or your relationship with the older adult, you must get the consent of the older adult. Now, we learned in substitute decision making that if you have an older adult who may have cognitive impairment and is incapable of being able to make that decision, the substitute decision maker is the person that you get consent from, and only the substitute decision maker. If there's no substitute decision maker, we know that it goes to the public guardian and trustee. Again, you have to be able to provide the individual with access to their own personal information, so it can't be locked away and they always have a right to see it. And the secure storage has to be there as well. And you have to make sure that there are measures implemented to protect patient records. You have a positive obligation as a healthcare professional to ensure that the destruction of the private information is done in an appropriate fashion, and that when the information is no longer necessary, you do destroy the information. Last, as a healthcare professional, you have a positive obligation to inform patients of the handling procedures through the different ways. Again, you can ordinarily have discussions between you and your health care provider as a patient. You can see posters, you can see brochures, etc. So those are really important to make sure. What about privately insured or privately paid health services? Are they considered commercial activities and subject to PIPEDA? Yes, PIPEDA doesn't actually discriminate between an organization that's paid in one way and an organization that's paid in another. So it's based on the activity itself. An example is if a hospital is charging for crutches, well, it wouldn't bring the hospital under the Act because crutches are part of the core activity. But in the case of privately owned medical equipment or a rental business for DVD players, etc., well, if the hospital allows the space to be leased to the operator, then the operator has to have the obligation to comply. So you can think of snack bars within hospitals. You can think of other commercial enterprises within the hospitals. The hospitals aren't required to cover the privacy issues of those leased organizations. But if you are engaged in your own commercial services as a private healthcare provider, then you certainly do have to comply. So the non-commercial areas of healthcare, like publicly funded hospitals, are not subject to PIPEDA. So this is the difference between healthcare providers, who are healthcare professionals, who have to have an obligation under their own professional duties, doctors, social workers, nurses, etc. They have their own professional codes of obligation. And a hospital. A hospital itself is not subject to PIPEDA, although they have their own requirements as well. And so why is a hospital not covered under PIPEDA? Well, healthcare in Canada, unless it's private healthcare, is not considered a commercial activity. And commercial activities are involved in things like leasing or memberships or fundraising, but it's not actually a commercial activity to provide care. people talk about a circle of care. And that usually talks about the individuals and activities related to care and treatment of a patient. And in this case, healthcare providers who deliver care and services for the benefit of the patient will be allowed to disclose to each other about the patient. So if you're going to have a team-based approach in a healthcare provider, that's usually a circus of care. So you are allowed to, with the consent of your patient, discuss a patient's case with whomever makes most sense of doing so. The rights of access under PIPEDA are not clearly defined, but usually it means that people can get information and access to challenge accuracy and completeness and to make sure it's amended. So if you are declaring that you want access to your personal information, you have that right. It's not specifically defined, but it usually means that you need to be able to see the documents that relate to you. Sometimes they'll talk about core activities. And core activities are the objectives or activities defined in the legislation about it. So if your core activity of a hospital is providing, if you will, housing and healthcare services, that makes sense. The core activity of a hospital is not to provide televisions, which may happen at a hospital, but it's going to be to a third party. A core activity of a hospital is not providing coffee, although some of us may think that it should be. So does PIPEDA apply to the entire health sector in Canada? No, it applies to the information that's collected and used and disclosed in course of commercial activities. So